Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome everyone to another episode of the Oncology Revolution Podcast. Today I will be the host. My name is Raquel Maris. I'm an occupational therapist with an executive MBA and I'm working as a project coordinator at the European School of Lifestyle Oncology. And I believe that everyone who is listening right now would agree with me if I say that breast cancer in men is often misunderstood, overlooked, and under-researched. Well, today's guest is actively changing that. I'm honored to welcome Cheri Ambrose, an internationally recognized advocate and thought leader in this field. She is the founder and president of the Male Breast Cancer Global Alliance and is a leading force behind shifting policy, influencing pharmaceutical change, and elevating public discourse surrounding male breast cancer. Cheri, thank you so much for joining us today.
Thank you, Raquel. It's a pleasure to be here.
Let's start at the beginning. What led you personally to become involved in this work?
A very dear friend of mine was actually diagnosed and reached out to me to ask for help in finding resources.
Well, and you certainly did that. How did people initially react when you said, I want to raise awareness about breast cancer in men?
I think there was a lot of confusion and a lot of strange looks. Usually people fight for a cause because it's something that's affected them personally or their family members. And I can honestly say the only cancer in my family has been lung cancer. But it's something that when I was asked the question to help, I decided to step in, and the more I learned about it, the more passion I got for the disease.
Sure. And we know that male breast cancer is rare, accounting for less than 1% of all breast cancer cases, and yet the consequences of delayed diagnosis can be severe. But most men they present with painless lump near the nipple or changes in the skin, and these symptoms are often go unnoticed or dismissed. Can you give me your perspective on why this happens? Why do men often delay seeking help or ignore the symptoms?
I think from an early age, as young boys, they're taught to be tough. If they fall, brush it off. Be a man as you get older. And they're taught to be the strong one, not to show weakness. And I think it stems from that.
Sure. And without awareness, the diagnosis also tends to happen at later stages, reducing treatment options and survival outcomes, right?
Yes.
There's still a lot of silence around male breast cancer, but could you tell me what are the biggest misconceptions you've encountered so far?
Exactly what you said. Men don't get breast cancer because men don't have breasts.
Do you think the issues of masculinity and stigma still affect so much the diagnosis and treatment?
I do. And it unfortunately it often leads to a more um, severe diagnosis, later stages of breast cancer, and less treatment options are available.
Sure. But you have begun a great movement, the Male Breast Cancer Coalition, back in 2014, and it has since evolved into a global alliance. What did those early days look like? Were there major challenges in convincing people that this is a topic that matters?
Speaking about changes, actually, the Male Breast Cancer Global Alliance has allowed me to advance my original scope. With this brand, I've been able to dedicate global outreach, and so not just domestically. Today, we're actually speaking to people in 40 different countries and involving organizations in all of these countries as well, getting them to understand that men do need a seat at the table and a voice. We've had actual we have an actual interactive map now on our website where people can go and find the pins, click on them, and they're seeing these men's stories around the world. We've evolved where we now have a newscast, we have a bi-monthly newsletter reaching the global communities. That's called Uncovered. That's something groundbreaking. We also have a very strong clinical screening and diagnostic branch that's led by Dr. Robert Bard. From day one, he's been behind us, supporting us, and thanks to his nonprofit work, we've been able to partner and reach with many men's cancer communities. And Dr. Bard has actually spearheaded a global effort to institutionalize men's cancers, emphasizing on the challenges and the solutions for rare men's cancers. Because there are more than just breast cancer. There's actually rare cancers such as Merkel cell cancer, anal cancers, certain types of prostate cancer, skin cancers. A lot of them are very specific and unique to men. And we're able to find a place for all of those to be talked about rather than being put in a nice, neat little box and saying, yes, but they're rare.
And that is an amazing work, and so actually so impactful that it goes to more than 40 countries. And I want to ask you, how did you grow from a local initiative to a global movement like it is right now?
It actually started as being a storyteller, finding these men through Google searches on the internet. I was finding men that were coming forward telling their stories, and I would reach out to them because, as we know, when we identify with somebody who looks like us, even when you go to a doctor, you're looking for somebody who understands you, who's, you may go to a woman doctor because it's more familiar to you. Well, men are doing the same thing. If they're seeing another man who's telling their story about breast cancer, they're going, oh my God, that's me. I can tell my story. So it's been through storytelling that's we've actually gotten this movement going.
That's amazing. And what kind of awareness campaigns have you found that are the most effective over the years?
Again, sharing these stories on social media platforms. We do have a space on all of the major LinkedIn, Facebook, X, Instagram. We're out on everything. We network with other breast cancer organizations. We bring a lot of breast cancer organizations in as resource partners, if you will. And the only requirement to do that is that they have a spot dedicated on their website that isn't just pink. It's something where a man going to their local known organization can actually find something that resonates with them and give them the resources and help that they need. An outreach to the members in the medical and scientific community who seem to have an interest in breast cancer in men, in the study of breast cancer in men.
That's amazing. And the idea of having the inclusion part of the men who feel included in the website, that is very important. And what kind of impact does peer support have in your view?
Peer support is huge for men. Again, going back to the storytelling, they're seeing somebody that's having the same struggles as them, so they're more apt to come out and talk about it. We offer trained mentors who can speak to men one-on-one. Some men are a little more private and they don't want to talk about it. And others are very vocal about it. And they honestly tell their stories because they don't want someone else to go through what they've gone through. So it's almost like they're giving people a warning, and they're actually doing a lot of the educating, which is wonderful to see.
That's so nice to hear. Do you think that cultural makes a difference? Rather, are there cultural differences in how male breast cancer is viewed and treated?
There absolutely are. I know here in the United States, communication is a big part in educating anyone. But here in the US, we're a little more direct. It's our nature to be direct. Our nature to ask for things. If something doesn't look right, we speak up. That can be a bad thing sometimes, but in this case, it has been helpful. And unfortunately, that is not a cultural norm everywhere in the world. Um, some of them, there are cultures where things are kept very private, where they don't speak about things. You don't share that information. It's a taboo. And those are the more difficult areas, and you just have to be aware of their cultures when approaching them and finding a way that makes them comfortable to come forward or discuss what their issues and problems are.
Exactly. I completely agree. And talking about research, we often think that we often talk about representation in medicine. And one of the things that makes your work so groundbreaking is your push to include men in clinical trials. Can you walk us through that advocacy?
Well, that started with me going to so many of the breast cancer conferences. When I started this, had no knowledge of the science behind breast cancer or what the clinical trial space looked like. But if I felt if I was going to be involved in it, I needed to know more to be able to help people. And I was always that little voice in the back of the room when they were discussing the clinical trials saying, and men, what about the men? And from doing that, I think it actually sparked the thought that men do need to be included in this space. And we do need to be looking at mouse models rather than just female mouse models. We need to look at male mouse models. And there seems to be a bigger understanding of that now, but it has taken a while. Rome wasn't built in a day, and it takes time.
Of course. What kind of barriers do you feel like there are still today? What frustrates you in this field?
My major frustration in this field is while men are included in clinical trials here in the United States, and the FDA has labeled medications and treatment protocols effective in men and women, sadly, because of the lower numbers of men in clinical trials, when these trials go over to different areas of the world, um, their healthcare is looked at differently, their regulations are different, and not having a lot of men included in these trials can be a barrier for us because oftentimes, even though a drug is for men and women here in the United States, in Europe, men may be pulled out of that and not allowed to have the drug because there simply weren't enough men studied in the trial. That's, I think that's my biggest frustration and my biggest wonder right now, and little by little working with the pharma companies, hopefully we can change that.
Sure, I hope so. And I was going to ask you, what could we be doing to break these barriers?
I think having the conversations with the advocacy reps that we speak to at the pharmaceutical companies, and I know this as a fact because I've had to do it twice now for men in other countries, is speak to the pharmaceutical reps. They all have global pharmaceutical partners or portions and areas that can probably work closer with the government leaders and hopefully change some of this.
I understand that your organization is making a difference, not just with the men, but also with the clinical community. I learned about your next mission to get national legislation to use ultrasound as standard care, as opposed to mammography for men's breast cancer. Can you explain this legislative proposal?
Yes, in working with Dr. Robert Bard, and Dr. Leonard Getz, we are reaching out to legislative bodies across the country to get ultrasound deemed as the standard for male screenings and basically for all screenings, but basically for men. Um, Mammogram machines were not designed for men. It's very difficult to get that small amount of tissue into a mammogram machine. And we feel that this is more cost effective. It's ultrasound can be portable. So it really is something that can be used globally. And even the screening and the reading of the ultrasound results can be done remotely.
That is amazing, and I truly think that would make a difference. Cheri, I would love for you to share a story with us. Could you share something memorable that still represents why you are doing your work today at the Male Breast Cancer Global Alliance?
One individual sticks out in my mind, and that is a gentleman who's unfortunately no longer with us. I met Alan Blood when he was first diagnosed at stage 2B with breast cancer. Um, I asked for his story. He shared it. He lived in Utah, had 6 children and a wife, worked and was going through his treatment and living his best life. He became metastatic. And at the time, I was pursuing the third week of October to be named Male Breast Cancer Awareness Week here in the United States. And to do that, I would go to the governor of each state and ask for a proclamation naming the third week of October as Male Breast Cancer Awareness Week for an individual that was surviving the disease in that particular state. And I had asked Alan if I could do it in his name, and he was so honored. I can remember he was further along in his treatments, and he was determined to go to the state house the day that that was being signed and be the face with all the other women. And he was able to do that. His family went with him. I think it was one of his proudest moments. And losing Alan um, was was hard. It's difficult to lose any of them. And to this day, we still remain in touch with his family. I think the biggest thing for me was that he really wanted to see his kids graduate from college and go on to be married. And sadly, they've all done that since he left us. But the family is thriving, and I think seeing that and his want for change and his need to have his face out there and be a representative for change and for men everywhere um, really has sparked that initiative in me, and it was one of the major reasons why I continue to do what I do.
Thank you so much, Cheri. That was a very touching story. Very nice to hear about it. And finally, one last question, or rather, a note that I wanted you to make. What is a key message that you would like to leave for our audience today?
Breast cancer affects all people. It does not know gender, and that men need to be aware of their health history. And if they see something or feel something, they need to say something. They need to get help.
Thank you so much. Cheri, you are bringing so much visibility, voice, and validation to so many men and families around the world, and that is very touching. Thank you so much for being with us, and more importantly, thank you for your work that you continue to do every single day.
Thank you, Raquel. I really appreciate it.
Thank
Bye,
you,
Raquel.
Cheri. Thank you so much.